Are you worried about how your vagina smells? Have you recently noticed a new or unpleasant smell from your private area? I'm Dr. Jaunbocus, an actively practicing GP and licensed doctor in the UK. And in this video, I will explain what's normal, what's abnormal, and what to do about it. Nowadays, there's a lot of pressure on women, especially the younger generation, to look and smell good. I've noticed an increase in the number of women consulting with me worried about the smell of the vaginas. Ladies often use strong perfume and soap to keep the vagina smelling beautiful, but this may be causing more issues than it solves. Vaginas aren't meant to smell like roses or a summer meadow. All vaginas will have a natural odor, which shouldn't be unpleasant and can be described as a mild musky scent. Each woman has her unique scent, which can vary from a subtle, slightly tangy aroma to a touch of natural perspiration. It's completely normal and a sign of good health. The delicate balance of good bacteria within your vagina causes this natural scent. Over time, you will learn to know what is normal for you. You may have noticed that your diet can subtly impact your vaginal scent, with some foods like pineapple known to make it slightly sweeter. After sex, you might also detect a change in odor. Additionally, you may notice a metallic scent from the iron in your blood as your period approaches or finishes. Right, so we know what's normal, so what's abnormal? A fishy smell. If you have noticed a fishy smell, it can be one of the two things. The first is bacterial vaginosis, also known as BV. If you have this, you may also notice a change to the colour and consistency of your discharge, which may become greyish, white, and of a thinner consistency, even watery. BV is caused by the overgrowth of some of the bacteria that live in your vagina, upsetting the delicate balance we discussed earlier. You are more likely to suffer from BV if you're sexually active, have had a recent course of antibiotic, or have been douching. Please don't douche. Our vaginas are self-cleaning and wonderful. You may also be tempted to use strong perfume, soap and fragrance to mask the smell, but this can make things worse as it can upset the delicate pH of the vagina, encouraging these fishy smell bacteria to grow. If you suffer from BV, don't worry, you're not alone. Around 1 in 3 women will encounter this in their lives, and it can be easily remedied with a course of antibiotic tablet, gel or cream from your doctor. The second reason you may have a fishy odor is trichomonas. Trichomonas is a sexually transmitted infection caused by a parasite. This infection is unlikely to go away without treatment, but can be effectively treated with a course of antibiotic. A rotten or rancid smell. If you have noticed a rotten or rancid smell, this can be caused by a forgotten tampon or some other foreign material. Surprisingly, it's pretty common. It can happen if you put a new tampon in, forgetting to remove the old one, pushing it deep inside the vagina, or having sex and the tampon is pushed to the top of the vagina where it is harder to retrieve. If you think this has happened to you, don't fret. Your doctor has likely seen this before and will be able to remove the problem quickly. In rare cases, an issue called a rectovaginal fistula can be the culprit. This condition creates an abnormal connection between your vagina and your bowel. Unfortunately, this connection can lead to poo entering your vagina, resulting in an unpleasant smelling discharge. Additionally, strong vaginal odour paired with unusual discharge could sometimes be associated with underlying health concern, including cancer. While it's important not to jump to conclusions, being proactive about your health is equally vital, so getting checked with your doctor is essential. A yeasty smell. Are you smelling a bready smell? It's usually not bad, but sometimes you may notice a bit of irritation, itchy, and even a cottage cheese-like discharge. That's right, you have guessed it right. It's vaginal yeast infections, aka vaginal thrush. Thrush is very common, And if you haven't had it already, you are likely to experience it at some point in your life. Thrush is caused by an overgrowth of yeast that naturally lives in your vagina, and this can be because of an upset in the balance of good bacteria in your vagina. You are at an increased risk of vaginal thrush if you have recently completed a course of antibiotic, you're pregnant, or have an underlying condition such as diabetes. But it can happen to any of us. Fortunately, it's easily remedied, and for most, this will clear with a short course of antifungal medication you can get over the counter at your local pharmacy. Metallic or coppery smell. It's common to get a metallic or even coppery smell at the start and at the end of your period. That's quite normal. This is because blood contains iron. However, if you get this smell throughout your cycle or between your periods, it can indicate the presence of blood when we wouldn't expect it. Abnormal bleeding can be related to an underlying hormonal disbalance, medications you're taking, and occasionally a tumour or cancer of the cervix, vagina, or your womb. Getting just a metallic smell is unlikely to be the only symptom of a serious underlying condition. If you notice unexplained irregular bleeding or bleeding after intercourse, make sure you get checked by your doctor. Ammonia. If the smell down there is reminiscent of powerful cleaning product like ammonia, it could be pointing to a urinary tract infection, also known as a urine infection. Don't worry, these urine infections are very common, especially for us ladies, and you may have encountered one before. Now, here's the deal. That smell is caused by overabundance of bacteria hanging out in your urethra, kidney, or your bladder. It often comes bundled with a not-so-fun package of symptoms like a burning or stinging sensation, cloudy urine, or the constant urge to run to the toilet. Sometimes you might even catch a fever. Sure, your diet, dehydration, and certain medication can occasionally lend a hint of ammonia to your personal aroma, but that should typically mellow out. If the ammonia scent persists or gets stronger, having a talk with your doctor is a good idea. They might recommend antibiotic to help clear things up and get you feeling back to your normal, fresh self. Doctor's tips. Here are some tips to maintain vaginal freshness. Avoid douching. Douching can disrupt the natural pH balance in your vagina, potentially leading to the growth of odor-causing bacteria. It's best to avoid it altogether. Choose breathable cotton underwear. Opt for comfortable and breathable clothing for your genital area. Steer clear of tight thongs that might restrict airflow. Cotton underwear allows your vulva to breathe, promoting comfort and reducing moisture. Skip strongly perfumed soap. Consider using warm water for cleansing your vaginal area. Your vagina is self-cleaning, and a daily rinse with warm water is generally sufficient. Stay hydrated. Proper hydration can help reduce the risk of urinary tract infection and minimize ammonia-like odor. Drinking an adequate amount of water is beneficial for your overall health. Avoid scented lubricants during sex. Scented lubricants may seem appealing, but they can disrupt your vaginal pH balance and the beneficial bacteria essential for your vaginal health. Opt for unscented, water-based lubricants for a safer experience. Finally, knowing what's normal for you is essential, so you know when something isn't quite right. If your vaginal odor is becoming more pronounced or you're experiencing other concerning symptoms, it's a good idea to reach out to your GP or your gynecologist.